A very good evening to everyone who has joined us today for this live telecast. We welcome you to this session that we, the Ambassador School Sharjah, are hosting today in association with Thumbay Group of Hospitals. This is an exclusive session to get insights on identifying speech problems in the early stage of a child's life so that the necessary action can be taken and required support can be given. We have with us Dr. Shadiya Risal, Senior Speech Therapist, Thumbay Group. Her area of expertise includes childhood language disorders, speech disorders, cognitive delay, articulation, fluency, voice assessment, and management. We are grateful to her for taking the time out to join us for this session. Welcome, Dr. Shadiya. We also have with us Ms. Jamila, the head of the counseling department, Ambassador School Sharjah, who will be the moderator for this session. Parents are welcome to share their queries through the chat box. So without further delay, let me hand over to Dr. Shadiya to take the session forward. Dr. Shadiya, please.
Hi, good evening, everyone. Myself, Shadiya Sigir. I am a speech language pathologist, currently working at Thumbay Rehabilitation Hospital, Ajman, and I'm specialized in both pediatric and adult speech, language, and swallowing disorders, especially for children with autism, ADHD, learning disability, and hearing impairment, DSL, ELD cases, and also adult cases with aphasia, dysarthria. And thank you for having me. So we'll start with the presentation now. Today, Today, I'll be discussing about the topic regarding raising awareness for speech, language, and communication needs. Okay, so if you have any query regarding this, you can send messages in chat box. Okay, so first of all, we'll discuss about the outcome regarding improved awareness of what is meant by speech, language, and communication skills, and also increase in knowledge about speech, language, and communication needs. Okay, so for language, there is a typical pattern in developing. If for kids, there is a typical pattern in language development. If you know this pattern, it will be easy for you to identify whether my kid is having any speech or language delay. If you parents know about these things, you'll be easily available to know how to diagnose, is my child having any speech or language delay, can I consult a speech language pathologist, like that. So first we'll discuss what is speech. So, speech is the expression or the ability to express thoughts and feeling by articulate sounds. So, speech is something only humans are capable of. And now we'll discuss the importance of speech in our everyday life. So, speech allows us to form connections, influence decisions, and motivate changes. Without communication skill, the ability to progress in this working world itself is nearly impossible. So, speech helps us as a society to resolve issues in a respectful manner. So, now we'll discuss the role of articulators in speech. Articulators means the oral structures that are responsible for our speech production. So, what are the oral structures responsible for speech production? They are our lip. I'll show you the image. Can you see the screen? Fine.
Yes, ma'am. It's
Okay.
very clear.
Okay. So, so articulators are the oral structures that are responsible for the production of speech. So you can see the structures now that are responsible for the production of speech: our lips, teeth, tongue, hard palate, uvula, our cheeks. These are the oral structures known as articulators that are responsible for the production of speech. Okay. If there is any problem with these articulators, like any abnormalities in these articulators, can cause speech and language disorders. And how can we identify the speech and early identification? That means the parents may have concern like my child speaks but her speech is not clear. Some parents will have the concern like the child can speak more but repetition, prolongation and pauses are coming in between speech. And also child misplaces letters, like instead of saying the letter k he says th, or instead of saying the letter ra he says la, like that. There is misplacement of letters. And also for some kids they may show fast rate of speech or slow rate of speech. And there are some cases with excessive air leakage through nose while speaking. So these are some of the early identification tips that your child is having any speech or language issue. Now we will discuss about what are the speech disorders, types of speech disorders. There are around three different types. First one is speech sound disorder. That means that affects the speech sound production. Second one is the fluency disorder. Fluency disorders means the fluency of our speech is affected due to this repetition, prolongation, and hesitations during speech. Third one is voice disorder. Voice disorder is caused by our larynx. Larynx is known as the sound box of our human body. Larynx is known as the sound box of our human body. And in larynx, we have vocal cords. And the vibration of these vocal cords produces sounds. If any pathology affects these vocal cords, it can lead to voice disorders. So, first we will discuss about speech sound disorder, articulation disorder. It means we are having any abnormality by birth, like cleft lip and palate. That means a portion of our hard palate is missing, or a portion of our lip is missing. This all can lead to speech disorders, speech production problems. It is known as cleft lip and palate. And the other condition is known as ankylosing. That means a tongue tie, like a small growth is present below your tongue, a small growth, so that you cannot move your tongue up, down or side. That can cause speech disorders. Yeah, it is. Yeah, this is the image of cleft lip and palate. The first image is showing cleft lip, and the second one is showing cleft palate. That means we can surgically remove this, but uh, there will be problem with nasality. That means exhalation air will be more during speech production in this condition. And the next image also. And this is known as tongue tie. That means the growth below, you can see a growth below our tongue, and it will be more, its length will be more, so we cannot move our tongue up, down, and we cannot produce some sounds like ta, da, na, like that sounds. Okay. And next we will go to the other adult disorders, adult speech language disorders. That means due to any motor problems, like aphasia, dysarthria. These conditions can cause due to stroke and other medical conditions. There will be like weakness to the oral structures that can cause speech problems. And next is fluency disorder. Fluency disorder can be defined as it as stuttering, cluttering. Stuttering means when we can speak but there will be more repetition. For saying bat, the kid is saying ba 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 bat, like repeating a particular sound, or repeating a particular word like bat bat, like more time repetition. And also prolonging a specific sound, like instead of saying bat he says bat, like that repetition is coming. And also cluttering. Cluttering means it is fast rate of speech. the speech production will be very fast, that the speech will not be intelligible to others can understand what your kid is saying. That is known as fluency disorders. And the other one is voice disorders. That means any growth in our vocal cords, like a nodule, a polyp, or a vocal cord paralysis, or this can cause voice problems, like our voice will be harsh, hoarse, or it can be breathy. So the voice, our speech will be unintelligible. These are some conditions related to speech disorders. Then the next is language. Everybody know that people are speaking different language. In especially in UAE, we have people from different cultures, so they'll be speaking different languages. Like it is a manual signed or written symbol by means human beings are communicating. There are around 6,500 spoken languages in the world today, and each language is unique. And how can we identify our kid is having any language disorder? Before attaining language, the kids will be attaining their pre-linguistic skills. That means before attaining language, they will attain the pre-linguistic skills, like pre-linguistic skills like eye contact, attention behavior, sitting behavior, eye-hand coordination. This all comes before attaining language. There are kids who lack eye contact, attention, sitting behavior. Parents should be concerned, like why my child is not having maintaining eye contact. Why my when you are calling his or her name, he or she will not be looking back at you. Like she'll be not listening to what you are calling, what you are saying. So all these conditions, parents have to be concerned. Like you have to meet a speech therapist. Like if you feel anyone among you having this kind of problems, you can meet a speech therapist. And if a child, like 3 year old child, should have a vocabulary of around 1,000 words, a 3 year old child should have a vocabulary of 1,000 words. If she or he is not having this 1,000 word vocabulary, you can definitely consult a speech therapist. And a 4 year old should be able to narrate a story himself, a 4 year old child. And a 5 year old should have a vocabulary of 1,500 to 2,500 words. And a 6 year old should speak a 5 to 6 word combined sentences. If there is any kind of delay in this developmental milestone, you can meet a speech therapist. Okay. And next is what are the childhood language disorders? Like how what are the type of disorders, language disorders you can see mainly in kids? First one is delayed speech and language skills. That means the child's comprehension, language comprehension and language expression, both will be affected in delayed speech and language skill. The child cannot comprehend what you are saying. If you are saying a command, sit down or stand up, the child would understand what you are saying. It is due to his delay in speech and language comprehension. And also, he will not be able to express himself, or he wanted to say something but he'll show actions instead of saying it. And there are some other conditions like down syndrome, many genetic conditions. This can also causes speech and language problems, delays. And other condition is expressive language delay, in which only the speech expression is affected. Their comprehension will be intact. That means they can understand, they can follow all your commands, but their speech expression will be affected. They can't say what they want to say. And the other one is specific language delay. That means the maybe you will be speaking 2 or 3 languages at home: English, Hindi, Malayalam, like that. And the child won't be able to say a specific language. That means he can speak Hindi and English but not Malayalam. Like if you have the child may face such problems, you can meet a speech therapist. And also next one is intellectual disability. That means the child's IQ, the ability to understand the things, the IQ level will be lower than that of normal kids. In these cases they may have speech and language problems. The other condition is phonological process and phonological disorder. That means they may replace the sounds. For I have told you before, instead of saying ra, they say l sounds. Instead of saying k, they may say the sound, like backing errors, friending errors. They may replace sounds. And one of the most important causes is hearing loss. And it's a sensory loss that can cause language problem. And the third is communication. What is communication? Communication is a process by which information is exchanged between individuals through symbols, signs, or behavior. There are different types of communication. As we all know, there are verbal communication, non-verbal communication, written communication, listening, visual communication. Now we'll discuss what is verbal communication. That means a verbal output. We are speaking through language. We are expressing our thoughts, feelings, and everything through our oral structures. Through by using our articulators, we speak. And next one is non-verbal communication. That means the communication by eye contact, through our facial expression, by our body movements, our touch. This all comes under non-verbal communication. Okay, so while speaking, we use both verbal and non-verbal communication. That means we have to maintain our eye contact, we have to listen, we have to attend what the people are saying, and we have to verbally express what it is. And the next one we can explain is communication disorder. If if you are not able to maintain eye contact with a person while speaking, and if you are not able to express the things you want to say, it means he or she is having any communication problem. Like you might be aware of the disorder, autism spectrum disorder. Like in these cases, the child may find it difficult to maintain eye contact, and the child may be difficult to maintain his attention span, to hear what others are saying, to understand what others are saying. He or she may maybe find it difficult. And in the case of attention deficit hyperactivity disorder, you people may be knowing, like they won't maintain attention, like they can't maintain at least a 1 minute attention. So in these cases and all, you can meet as a speech therapist. And also communication disorders like language disorder, speech sound disorder, childhood onset fluency disorder, unspecified communication disorder. These all are conditions a speech therapist treat. Okay. Now, next one is how a poor communication skills impact on a kid. Like I'll tell you, poor communication can affect their educational achievement. Like if they can't communicate well with others, it can cause their academic performance. They will be compared to the other kids, they will be lower in academic performance. And the second one is behavior or vulnerable. Like 7 to 14-year olds with serious behavior problem have language impairment, and it can cause their mental health. Like 7 to 14-year-old referred to child psychiatric services had a language impairment. And it can cause employability. That means 47% of employers say they can't get recruits with the communication skills they need. And it can also lead to criminality. Like 65% of young people in young offender institutions have communication difficulties. And the other condition is a disadvantage cycle. That means children from low income families lag behind those from high income ones by 16 months in vocabulary. And now will discuss like what are the ways an SLP or a speech language pathologist can help you with your child's speech and language development. And a speech language pathologist is a person who works with children with mild problem to serious complex disabilities like autism, Down syndrome, motor speech disorders, etc. A speech language pathologist can help a child with speech intelligibility. That means if a child is having a problem in producing specific letters, the child may find it difficult to speak it clearly. So, SLP can help you to improve the intelligibility, overall intelligibility in speech. And an SLP can teach your child the strategies on how to control fluency disorders and secondary behaviors. If you face any kind of fluency disorders like stuttering, cluttering, and all, they may also show some secondary behaviors like mouth covering, head nodding. All these behaviors can come secondary to fluency disorders. And also, an SLP uses alternative and augmentative communications using picture, symbols, communication boards, as well as various electronic devices. And also, SLP helps with cognitive communication skills and also helps to assist improve expressive language skills. And what can you do to support? What can, as a parent or as a teacher, you can do to support your kid to improve his or her language ability? First one is supporting listening and attention. You should support your kid to attend and to listen to the things. Like you have to sit with your kid in a face-to-face way and singing rhymes, showing actions, playing with them. All these things can improve their speech and language comprehension and expression. And also supporting play and interaction, like play activities with the same age kid and also with parents, with family members, with their friends. Let them interact with others, play and listen to the others and interact. Social interaction, social smile, social communication is one of the main component that can increase their speech and language output. Next is supporting receptive language. Make them understand the things. Like if you are doing something, don't get angry at them. Just make them understand. Explain to them each and everything so that they can understand what you are saying, what you are saying to them. Okay. Next one is supporting expressive language and ask questions to them. Ask questions regarding each and everything and let them express the things they want to say and make time to them. Supporting vocabulary, like give them many flashcards, books, and many other things available in the store, and let them explore the things and let them speak other than using these gadgets. Let them use more flashcards, more books, more picture or objects like that. And also you use useful resources and websites. This can help them improve their speech and language skills. Thank you. Mhm.
There are some questions. Shasha asked, "Hi, my son is 1 year 11 months. He is able to understand everything whatever we ask with him, but his communication is not clear. He talks in his own language.
Mm.
Some words he can talk. So if you can answer,
Yeah.
yeah, you can see the question.
A very good evening, Doctor. It was a very informative question, I would say. Definitely, it was in a very quick glance, a very quick understanding about what exactly are the speech and language disorder and how, as as a parent, we need to be really very careful on how to, like identify and help our children in supporting their language or the speech concerns and all. So now there are few questions which have been raised by the parents. Okay,
Okay.
I think one of the parents, I think his child is very small, but still I'll raise the question that the child is
Okay.
1.5 year old, but the communication is not clear. So is it normal or it's not? So um, that's the thing. If you
Yeah,
can.
for for a 1.5 year old kid, like you have to see like speech milestones first. At 3 months, child starts making coo sounds. When he becomes 6 months, he starts babbling sounds, ba sounds. And when he becomes 1 year, the child starts saying his first word like mama, papa. You check all these things, and if you are having more concern about his attention, eye contact, and all, you can meet definitely you can consult a speech therapist if you're having more query about it. Like in Thumbay, we are providing now free assessment for speech therapy. So if it's possible for them, they can directly come here. Yeah.
Okay, yeah. So there's one more question from another parent, and I think this is one of the very general thing what we observe in the school as well. Okay, where a
Yeah.
child is 3.5 year old, the child is very fluent in the mother tongue language. Okay, but struggles with English. You know, the English language still not yet developed. So does he or she has any speech concern?
See, for a specific, it is we can say it is a specific language problem. So it is not a very big problem. Like if the child can identify and express all the things like lexical category items like fruits, vegetables, animals, birds, if he or she can express all the things in his or her mother language, that means he can identify and he can express it. It's only problem with the other language, so we have to teach them other language. The child is problem with same mother tongue also, then it will be as big speech issues. But now for this condition it may not be a very big problem, I think.
Uh, yeah, yeah, that's correct. You know, doctor. Definitely, it is like that. But at the times, you know, the child really takes a time, especially in the school setting. What we have observed, okay. Now at kindergarten level, we teach them phonics and all, but they do take time to pick up on the phonetical skills and all. So, is it okay? It's just they need a time and they need more effort, or it's something concerns are there in that case?
If it is like the child can't understand anything, like if you are saying him to sit down, stand up, the child is not attending to the thing you are saying, you have to be concerned. Like if child is not attending, this child is not understanding your commands, if it is like that, you have to be concerned. And if the child can't express it like in all languages, not in one specific language, in all languages, if child can't understand what you are saying, or child can't express the things he want to say, like you should be concerned. If child is not attending, child is not understanding, and child doesn't make eye contact, and if you're facing all these problems, you can directly come to consult.
Okay. Now there's one more. There's a, like, you know, the child is 3 years old. The child talks in some words, okay, but not put expressing himself or herself in sentences. Is it normal or there's a concern? So,
Yeah,
you know,
like
like I think we can just brief the parents what is the expected level of speech development at each, you know, how many words a child at 3 years, 4 years, and 5 years should be basically knowing. So I think that will help, because there's one more question similar to that. When a child is 4 years old, can talk, you know, say things like whether it's a name of a fruits, vegetable, or general objects, you know, in words, but not putting it in the sentences. So, you know,
okay. The thing is that when a child become 1 year old, he or she start saying his first word. At 1 year, the child will speak his first word, like mama, papa, like this combination will be there. Sometimes it will not be meaningful, but the child will start saying mama, papa, like this phonemes will be there. When a child turns 1.5 years, he starts saying mama go, papa go, like this two-word combination starts coming. Okay, at the when he or she become 3 years, he will have at least 1,000 word vocabulary. That means he can understand and express most of the things like common things we see around animals, birds, fruits, vegetables, and he can also say ask his needs, water mama, water papa, water, like that at 3 year old. And when he or she become 4 year old, like he can express a story himself, like short stories he'll be able to express. Like you can check whether my child is having 1,000 word vocabulary, or my child can say a story himself. A 4 year old, that means story means he will combine three word, like three word sentences, four word sentences will be there. And when he becomes like 6 year old, he will be combining like 5 to 6 word sentences while speaking, when he becomes 6 year old. So check this. If there is delay in this expression, you can definitely consult a speech therapist and do an assessment, like what is his language age now. You can check like that.
Yeah, that was quite informative. Definitely. There's a parent who has written. I'm not sure they've not written the age of the child. There are two boys. Okay, both have the tongue-tied problem. Okay, but the communication is quite clear. The concern what the parents has raised is the child is not, like able to whistle or I think those sounds and not able to take the tongue in and out. So is it okay or it would be a concern in the future? That's what parent want to know.
Like I want to know like how is his tongue movement and all. Like communication is okay means the child can produce all the
It's very
sounds
clear.
clearly.
Yeah, both communication is very clear. That's what is written. So I'm not sure. And if that parent can even put the age of the child, that would be better.
Yeah,
Also
yeah,
for the doctor to understand. So please, but is like the child is not able to take the tongue out and in. That's
yeah,
a thing. I'm not able to produce like whistle or not able to say the sounds like whistling sounds and all that are not
yeah.
coming.
This
Is it
if
okay? That the parents want to know.
if they want a detailed assessment about it, yeah, of course they can visit here because it's like I want to check whether they have tongue movements. Like if they have tongue movements, they can produce the sounds clearly. If they are not having this tongue movement, their speech will be unintelligible. It won't be clear much. So we have
The
to check all
child
that.
age is 9 year and 5 years old.
Nine
Both of
year old
them.
kid.
Yeah, one is 9 year. Other one is 5 years old.
And about his tongue movements, how is it? No, it's
I'm not sure whether the parent will know about the
yeah,
tongue movement in a professional aspect, but the parent
yeah,
has written the communication is very clear and good. So I
mm,
would suggest the parent maybe you can have a visit. Then only you will understand whether
yeah,
the child is. They both can move their tongue. That's what the parents say. But I think that is what from a parental perspective as a general. But maybe if
mm,
you need, as there is a concern of tongue tightness, maybe you can have a
mm,
professional opinion being taken so you have a better clarity. Now there's one more parent who's written, the child is 4 years old and cannot produce the sound. The pronunciation with the sound R was not clear. Instead of that, L sound comes in, like which is very common.
yeah,
So should they approach a speech language professional or should they wait for the child? For
yeah.
as it's the child is just 4 years old.
4 years old, yes, of course, you can consult a speech language pathologist for this problem. Like we can give, we have many therapy techniques for producing, like to show them the correct oral placement while saying the R sound and all. So you can definitely consult a therapist for this.
Um, okay, the child. Okay, one more parent has written, my daughter is 6 years old. Some lengthy words she cannot pronounce it very clearly. What kind of practice do I have to do?
Lengthy words means they can she's speaking clearly in sentences and all, but some problem with some words only.
Yeah, maybe the longer. If a parent can just elaborate on this particular thing, can you give an example so we
You
can
like
understand it in a better way?
you can
So
give her language stimulations, like expand, extend the language you are saying, make it clear to her, explain to her in a very clear manner, show her the correct placement of articulators when saying the particular word, make it clear to her. That only you can do for this.
okay, there's one more parent who has written the child is 3.5 years old. She's able to tell the previously told stories, which generally what the parents communicate with her at home. Okay, but the own stories, what a child, at a times blabber or they create at the age, the child is not able to, frame the sentence or make it in that way. So, would you encourage? How would the parents want to know how to encourage the child to create their own story or to start communicating in their own language?
That is a good question. Actually, I would say that there are different websites now available. Like you can check like speech therapy activities in net. We can see that like many flashcards, many picture books, many cards and all. Like like puzzles, you can arrange like puzzle stories can be arranged like puzzles. You can use all these materials to let them speak through different activities, through coloring, through painting. You can see different flashcards, different story books like puzzles. You can make them arrange these things and let them speak with that.
Okay. There's one more thing here, like from the school side. Okay. Although the child doesn't have a speech concerns, okay, but there are, as we were talking about the other disorders. Okay, if there is a severe case of selective mutism where the child is not talking, okay, but we really don't know about the speech part of the child, but the video of the parents and all says that the child is quite okay in communicating at home, but doesn't have or doesn't expresses himself or herself in the school in the same way. So how do we go about, like that is from the school side. I just want a guidance on that part.
Yeah, like first of all, you have to check the child's eye contact, how he is maintaining his eye contact with teachers, with friends, with parents. Like he is maintaining eye contact or just turning his head when, well, like even when you are asking him what is your name, the child won't respond by looking into your eyes. Just check that his eye contact, his attention, all these things. Can he maintain attention? Like can he sing a rhyme himself? Alone, like rhyme for 1 minute, 2 minute rhyme. Can he sing himself? Check all these things and see like the kid is confident in speaking, or the kid is having any other like comprehension or expression problems. You check that, and based on it, we can see. Or if the child is facing all these problems, definitely you have to meet a therapist or a pediatric doctor like that. Otherwise, it's fine. If the child can maintain this eye contact, attention, and comprehension, then it's okay. You can continue with the child.
Okay, also there's like there are what are a few strategies, if we can, and especially if the child has echolalia concerns, and we observe few children in the school. Of course, the speech therapist is required, but from the school side, in those situations, how can we help that child, to build his more confidence in the classroom setting, especially if the concern is with echolalia.
To make a child express, first of all, let him know, identify all the things. Like I told you, the lexical categories. Let him identify all the things around him. The small things, animals, birds, vehicles, all these categories, common objects, actions, everything. Let him identify all the things and let him express this. What is this? What is this? If he can understand and express all the specific things, then definitely he will start speaking in sentence, two-word combination, three-word combination. If he don't know what is this, if he can't identify what is this, then of course there will be problem with expression also. If he can identify all the things around him, the things you are teaching him, especially in school, teaching alphabets, numbers, if they don't know what is this, they will not say, they will not express if they don't understand what it is. So first, let them understand the thing, make them understand, make them attentive in class, and after that, you work on their expression.
Okay, I think that was the questions which were being posted by our parents. So thank you so much, parents, and thank you so much, doctor. Uh, okay, yeah. I'm like, I don't know. This parent wants to know what is the right age to start for the formal vocal music training for a child? Is there any specific age or any age is fine for a child to start off with a vocal music training?
No, there is no specific age for starting vocal music training. Actually, for kids, it is very good to like not training vocal music training. I'm just saying normal rhymes. You'll be singing to them. Normally, you'll be singing rhymes from nursery itself. We'll start it. Okay, and that's really very good for their improving their attention span. Singing rhymes and let them sing with you, let them show actions with you. All these are very good in improving their attention span, to maintain their eye contact. These things will be very helpful.
Yeah, there's a parent who's asking this. Can you suggest a few speech therapies website, um, uh, where they can actually take few help from? So, can you just suggest a few speech therapy website?
One is mommy speech therapy materials, and there are many YouTube videos related to it. Just one minute. So you can use this websites like mommy speech therapy activities, like that. You can specifically type it. Then definitely you can see like articulation screener, and many are there. Many websites are available now. You just Google it and you'll find it.
Yeah. And also, there's one parent. I think that's a question more to the school, so I'll just answer that. Is there any option for such children in ambassador school? Uh, of course, we are an inclusive school in that case, but the speech therapy, I think we do the referral for the external therapist to be, where you have to take your child for an external therapy. So definitely in-house external, internal therapy of speech we don't have as of now, but I'm sure as doctor is saying, you can, if your child has some speech concern, you can definitely take him or her to the Thumbay Hospital Physiotherapy and Rehabilitation Center for the further guidance.
Yeah, we will be providing like a free assessment vouchers from our hospital. If we'll give to the principal or vice principal as your need, like you can contact us based on who are one. You can contact us.
So I think there are no more further questions. I think you have. Thank you so much for clearing all the doubts. It was very informative, and it was. I think that helped parents to come up with more and more doubts and ask more and more questions. So from our side, I think I'll hand over to Ms. Shaista for vote of thanks. Thank you so much, Doctor, for a wonderful session and wonderful information which you have shared this evening and made this evening so enlightening.
Thank you. Thank you so much for having me. Thank
Good evening, ma'am. On behalf of all the members of Ambassador School Sharjah, I'd like to extend my hearty thanks to you, ma'am, for your enlightening and insightful session. We really appreciate the time you have taken for being with us and sharing your knowledge with us today. And you have indeed given us a clear understanding about identifying the speech concerns at an early age and the consequence of the strategies we should be taking. And also the detailed information which you have given us today, ma'am, about the different speech, language, and communication disorders were very informative, and you have enlightened with interesting facts like a 3-year-old must have a vocabulary of 1,000 words, a 4-year-old must be able to narrate a story, and a 5-year-old must be able to have a vocabulary of 1,500 to 2,500 words. lacking in which means that we should consult a speech therapist. And you have also given us today useful guidelines like on how or what we can do to support their language development. It was really a pleasure listening to this patient, ma'am, and we hope you will be able to join us again sometime in the near future. So thank you, ma'am, for answering all the queries patiently, and it was indeed a wonderful session. We really appreciate you. We all enjoyed the session. Thank you so much.
Thank you.